Hey, everybody, you are the Silver Hill Hospital Grand Rounds program. We'll get started in just a moment as people settle into their Zoom experience. All right. Hello, everybody. Welcome. I'm Dr. Jeff Katzman. I'm the director of the SHARE program at Silver Hill Hospital. SHARE is an acronym we created. It stands for the Silver Hill Academy for Research and Education. And we are absolutely delighted to have you join us. Today, we're privileged to welcome Dr. Kenneth Pargament, presenting on the topic of spiritually integrated psychotherapy, addressing the sacred dimension in clinical care. Some housekeeping to start. Today's our last Grand Rounds before the summer break. Our next Grand Rounds takes place on September 10th with Silver Hill Hospital's Dr. Amy Swift, who will talk to us on the topic of management of aggression and how this may be managed in the case of substance use and detoxification. To see all of our upcoming Silver Hill Share events, visit silverhillhospital.org/calendar. If you would like CME or CEU credits for today's Grand Rounds, please complete the evaluation survey that will automatically show in your browser when we end the webinar. A link to the survey, recording, and slide presentation will also be emailed to all participants tomorrow. So that everyone has enough time to complete the survey, it will remain open to the end of the day on Friday. Certificates will then be emailed within a week. Any questions, please contact us at shhevents@silverhillhospital.org. In addition to the session evaluation, watch your inboxes for our Share Participant Survey. Your feedback is really very important and appreciated and will help us design our educational program for 2026 that we are currently putting together. Okay, back to today's lecture. Your questions remain an important part of our Grand Rounds, and I will moderate a Q&A discussion with Dr. Pargaman at the end of his lecture. This is a great opportunity to put forward questions and comments to Dr. Pargaman, which you can submit anytime during the lecture by using the Q&A link. And finally, disclosures. No planners of this activity have indicated a relevant financial relationship with an ACCME to find commercial interest. Dr. Parkament will show a slide with his disclosures when he begins. And now it is my really great pleasure and honor to introduce our guest speaker today, Dr. Kenneth Pargament. He is a professor emeritus of psychology at Bowling Green State University and adjunct professor in the Department of Psychiatry at Baylor Medical College. Dr. Pargament has authored over 300 refereed articles on the relationship between religion and mental health. He has written The Psychology of Religion and Coping and Spiritually Integrated Psychotherapy. Dr. Pargament is editor-in-chief of the 2-volume APA Handbook of Psychology, Religion, and Spirituality. With Julie Exline, he has authored the recently released Working with Spiritual Struggles in Psychotherapy, From Research to Practice. He was Distinguished Scholar at the Institute of Spirituality and Health at the Texas Medical Center. His awards include the Oscar Pfister Award from the American Psychiatric Association, the Distinguished Service Award from the Association of Professional Chaplains, the first Outstanding Contribution to the Applied Psychology of Religion and Spirituality Award from Division 36 of APA, and an Honorary Doctor of Letters from Pepperdine University. And Dr. Pargament was named one of the 50 most influential living psychologists. That's just quite a thing to be named. So with that, I will now pass the baton over to you, Dr. Pargament. Thank you for joining us. It's been great chatting with you before we went on today and meeting you, and just a really heartfelt thank you for joining us today. And I'll turn my screen off and see you, assuming all goes well, at the end with some questions.
Well, thank you very much, Dr. Katzman. And I'm excited to be here today to speak with all of you about spiritually integrated psychotherapy and the vital role it plays in mental health care. Let me switch to share screen right now. Okay. Oh, good. It's working, so that's a relief. Um, my thanks to the John Templeton Foundation for their support of some of the research that I report today. And I just want to say more generally that I'm so grateful to my colleagues and clients who've collaborated with me over the years. This area of religion and mental health is rich and complex and can be confusing. And no one person, I think, can get a handle on this on their own. It really takes a team, and I've been so fortunate to have a wonderful team of collaborators all over the United States and now globally. So I'd like to thank them. And the first thing to do is to acknowledge that I have no relevant financial relationships to disclose in relation to this presentation. So let me talk about the objectives of this presentation. First, I want to provide a brief rationale for why spiritually integrated psychotherapy makes good sense. A lot of people, I think, have some questions, even skepticism about that. So I like to provide an empirically based rationale for that. And I hope you'll be able to generate some of those reasons yourself as a result of this talk. Next, I'd like to talk about how do we do spiritual assessment. It's a critical part, I believe, of the more general assessment process. So I'm going to be kind of practical, hands-on, talk about how we can do that. And I hope you'll be able to generate some questions of spiritual assessment as a result. And lastly, I'd like to talk about ways that we can help our clients and patients address and access their spiritual resources in treatment and also address spiritual problems that can and do arise in treatment as well. Well, let me put this work into a bit of a context and give you some background. Since I started doing this work almost 50 years ago, it's amazing to think about that. Um, the field's really had a big change in attitudes. Back in those days, in the 70s, when I was starting out, the field was dominated by behaviorism and psychodynamic perspectives. And the leaders of both orientations, B.F. Skinner and Sigmund Freud, uh, were not exactly big fans of religion. In fact, they viewed it antagonistically. Freud, for instance, wrote that religion works by distorting the picture of the real world in delusional manner, by forcibly fixing adherents in a state of psychical infantilism, and by drawing them into a mass delusion. And his attitude toward religion really did have important implications for the shape of the field for many years. Since that point, I want to add that a number of psychodynamic theorists and therapists have moved well beyond that initial antagonism and are now finding really neat ways to integrate spirituality into treatment. But this kind of attitude really did shape a lot of people's thinking. I recall, again, in the 70s, one of my first projects was to interview community residents about what part their religion played in their daily lives. And they're very interesting responses. And I was speaking to one of my colleagues, a clinical psychologist, about it. And he asked me for an example. I said, well, I just spoke with a woman who said that every morning when she's getting ready to get to work, she talks to God. And it's a daily, it's a daily kind of process for her. And his response was, well, she must be schizophrenic. So that was a kind of a sign of the times. And this did find its way into clinical care. I'll tell you one story of Alice. This isn't really Alice's picture, but she was a real character, and that face just reminds me a lot of Alice. I saw her when she was in her 30s. Um, she was dealing with bipolar illness, and she'd been dealing with it for a number of years, over 30 years. And she was a real mental health veteran. She'd been seen by numerous psychiatrists and psychologists and social workers. But she came to me to see me. And I have to say, for the first few years that I worked with her, I was no more successful than other providers. I needed to hospitalize her several times for those periods when she was suicidal, um, and she had terrible mood swings that really interfered with her capacity for any kind of, normal life. So one day she came in, and again she was feeling suicidal. She was crying and pretty hysterically, and I was thinking to myself, "Oh my gosh, I'm going to need to get her to the hospital again." Feeling just very frustrated that I couldn't seem to help stabilize her. She was such a very, very nice woman. But in the midst of her upset at one point in the session, she cried out, "When will my suffering end? Oh, when will my suffering end?" Now, Alice had never described herself as a religious or spiritual woman, but her words sounded like a biblical lamentation to me. So I responded using similar language to Alice's. I said, "Alice, where do you turn to for solace in the midst of your suffering?" That's not my usual language either. I'm not usually a solace kind of guy. Um, but she stopped and she looked at me, and then she said, "Well, I've never said this to anyone before, but when I was first hospitalized, I was only about 13 years old. They put me into, I called it the rubber room because it was padded so I wouldn't hurt myself. And I was on restraints, and I just felt so awful. I was crying and crying and crying, and I thought my life was over. And then I started to feel this warmth in the center of my chest, and it began to radiate out to the rest of my body. And then it spoke to me, and I was really struck by that. And I said, "What did it say?" And she said, the voice said, "I'm with you. I'll always be with you." I said, "Wow, who was speaking to you?" She said, "Oh, that was God. God was telling me that, in the worst of times, he would be there for me." And I was just, again, struck by that story. And I was also noticing that as she was talking about it, she had calmed down. She was no longer crying. And I asked her whether she felt comfortable at this point that she could go home and not hurt herself. And she said, "Yeah, I think I can." We spoke about this experience for the rest of the session. And as she was leaving the office, uh, I said, "Alice, you said something that I'm really, really wondered about. You said that in all of your years of treatment, you've never mentioned this experience to anyone. How come?" And she said, "Well, they already think I'm crazy." Again, a comment on the times. Now, drawing on that resource, that capacity she had for spiritual experience did become a key to her more successful treatment and recovery, but I'll say more about that later. Well, over time, the attitude shifted in the field from antagonism to religion to, I think, uh, more curiosity. My sense was that many mental health professionals were finding something missing in the main therapeutic paradigms of the time. They didn't deal with the real basic existential concerns that they were hearing, concerns about meaning in life, about human strengths, about human finitude and frailty. And they didn't deal with the possibilities for real transformation. So there seemed to be a yearning, I think, among many people in the field for a deeper psychology, a psychology that could encompass these aspects of what it means to be human. And maybe as one reflection of that yearning in the mental health field, we started to see a rise in studies of religion and spirituality. Um, and this research was not only interesting from a theoretical and scientific point of view, it practically helped to create, I think, a rationale for integrating spirituality more fully into mental health care. So let me just say, briefly summarize this rationale. First, the research showed that religion is a cultural fact. Surveys show that across the United States and many other countries, most people report that they pray daily. Most people report that they're affiliated with some religious or spiritual group. Most people believe in a life after death. And surveys show that many clients, most clients, would like to be able to talk about spiritual matters in treatment. Clients like Alice, who might have liked to talk about it or would have liked to talk about it if she didn't think that she would be judged harshly from us. And research showed that spirituality is a resource to many people. Let me highlight that point with this example. Um, this is an illustration graphically of the number of Google hits for the word prayer in the months in 2020 when it was becoming clear that COVID-19 was rapidly spreading. And you can see in March how the number of hits for the religion word just skyrocketed. And it's an indication that in times of stress, when people are facing difficult periods, they often look to their faith for support and help. And empirical studies are consistent with that. For instance, just a few examples. In one study of people following Hurricane Katrina in Mississippi, people who turned to their religion for help and coping showed less risk of PTSD, depression, and better quality of life and less alcohol use. In another study by my colleague Gail Ironson at University of Miami, she studied HIV patients in mid-disease and found that people who relied on spiritual coping methods survived over 17 years longer on average. And one more study, a meta-analysis of research on stress-related growth, 103 studies, showed that people who turn to their religion for help and coping, that's the strongest predictor of growth following major life crises. It's stronger than social support and in general coping and other psychological factors. There is a flip side to religion, though, and religion and spirituality can also be linked to poor mental health. Paul Preuser, the eminent psychologist of religion, said that there's a seamy side to religion and spirituality, and he talked about religion and extremism, prejudice, religious hypocrisy, how it can foster crippling guilt, passivity, denial, and abuse. One spiritual problem in particular has received a lot of attention recently, and I've been among those quite interested in this topic, and that's the topic of spiritual struggles. Spiritual struggles refer to experiences of tension, strain, and conflict about sacred matters within oneself, with others, and with God. My wonderful colleague, Julie Exline, and I identified 6 types of struggle. Struggles with God, struggles around demonic or evil issues, struggles about questions about religious dogma and thinking, struggles of whether one has ultimate meaning in life and what that looks like, struggles about moral issues and living according to one's higher principles, and struggles with other people about religious and spiritual matters. Here's an example of a divine struggle. This came from one of my students, an undergraduate in my Psych of Religion class, who emailed me this after my lecture on struggles, and she was dealing with bipolar illness. And she writes, "I'm suffering, really suffering. My illness is tearing me down, and I'm angry at God for not rescuing me. I mean, really setting me free from mental bondage. I've been dealing with these issues for 10 years now, and I'm only 24. I don't know why he keeps lifting me up just to let me come crashing down again." These kinds of struggles aren't uncommon, and they've been tied to a number of problems listed here, including a higher risk of mortality. And struggles are often the precursor to religious and spiritual disengagement. One more rationale for spiritually integrated care is that spiritually integrated therapies have been shown to be at least as effective as other mental health treatments, and in some cases, more effective. So, as a result of this growing body of evidence, attitudes started to shift, maybe from antagonism to questions, though these are interested kinds of questions and confusion. And more practitioners seem to recognize that spirituality was important to many clients and showed some willingness to address this dimension. They just didn't know how. And with good reason. Surveys have shown that only a minority of programs, training programs in clinical psychology and in social work offer any education or courses in religion and spirituality. I think that that percentage is higher within psychiatry. So we've seen a shift from antagonism to questions. And today, I think we're seeing real interest in the possible integration of spirituality into mental health care. But we're left with a key question. How do we do it? How do we integrate spirituality into clinical practice? Before I offer some responses, let me say a word about the meanings of spiritually integrated therapy. What is it? First of all, it's holistic. It has to do with people as biopsychosocial, spiritual beings, the whole person. It's integrative. It has to do with helping people put the pieces together in their lives. When we see people who come to us with mental health problems, they often feel in some ways broken. And part of what we do in our work is to try to help people put the pieces together of their lives and find greater integration and wholeness. Spiritually integrated therapy is a part of that process. It's also pluralistic. It's not specific to any tradition, though it is always informed by the patient's larger religious and spiritual context, whatever that may be. And I should say along these lines that personal religiousness doesn't equip us to do spiritually integrated therapy. In fact, it can be a liability if it makes us assume that we know someone's inner life because we belong to the same denomination as them, or because we have some devotion to religion as they do. Conversely, being non-religious or of a different religious tradition than your patient doesn't disqualify you from doing this work. The key is your openness, your sensitivity, and your willingness to learn. Many of the basic factors that form the kind of common factors that we know are so critical to effective care. And finally, I want to stress that spiritually integrated therapy, it's not a competitor to existing treatments or orientations. It's not another three-letter acronym therapy like CBT or DBT or ACT. I don't talk about it as a SIP. Instead, I think it can and should be integrated into any treatment orientation. Effective treatment spiritually, I think, rests on a set of spiritual competencies. My colleague Cassie Veaton and others have conducted surveys to identify these competencies, and she has identified 18 of them. Here, I'd like to just focus on 3 of these competencies in this talk. First, practitioners, oops, here, I gotta get back to my, yeah. I just cut myself off here. Okay. Yeah. First, practitioners should inquire about people's spiritual and religious backgrounds, beliefs, and practices as a routine part of mental health practice. Here we're talking about spiritual assessment. Second, practitioners should be aware of the ways that spirituality and religion may support psychological well-being and support clients in accessing these religious strengths and resources. And third, practitioners should be able to identify and address problems related to religion and spirituality that could adversely influence people's psychological well-being. So let's talk about these three basic competencies now. And the first one is building competency in the area of spiritual assessment. Now, an important foundation to be able to assess a client around religious spiritual issues is the ability to distinguish spiritual experience from psychopathology. There are no hard and fast criteria for that type of differential discrimination. Instead, we have to examine a variety of indicators as a whole. James Griffith, who's written extensively on this topic, a psychiatrist at George Washington University, he's listed some of these questions. So let me review some of them briefly with you. Is there a cultural context for the spiritual experience? In other words, is it normative? Even if an experience may sound unusual or odd to us as outsiders, if it's normative within a particular context, we don't treat it as pathological. Do brain executive functions operate normally in usual life? In other words, is the spirituality interfering with normal cognitive functioning? Do spiritual beliefs help or hurt a person's relations, work, and daily life? This is probably the most important criteria, and it speaks to the fact that really we're evaluating spirituality pragmatically when we're trying to distinguish it from psychopathology. Does it help or hinder? Are there other associated symptoms of psychotic disorder, such as positive symptoms? And has there been a robust response to pharmacological treatment? And if so, we tend to think of it more as a psychiatric issue than a spiritual issue, even though there's often overlap between the two. Okay, with that in mind, how do you do the assessment? Well, first, I think it's important to be able to weave questions about spirituality into the initial interview. And clients are more than happy to talk about spirituality in their lives, but may hold back because they sense that we, as practitioners, are uncomfortable or unwilling to listen. And certainly that was the case with Alice. But we can ask a few simple questions that really should be integrated into the general assessment process. Here are 4 questions that I found really helpful to get a sense of whether the person is seeing life through a sacred lens and whether they're embedded in a religious context. Do you see yourself as a religious or spiritual person? And if so, in what way? Are you affiliated with a religious or spiritual denomination or community? If so, which one? Has your problem affected you religiously or spiritually? And this opens the door to the discussion of the potential spiritual impact of a psychological problem, such as a spiritual struggle. Finally, has your religion or spirituality been involved in the way you've coped with your problem? And this gets at whether spirituality could be a potential resource in the problem-solving process. But asking spiritual questions isn't enough. We also have to try to communicate an openness to learning about spirituality. If you want to be able to cut off any hope of conversation in this area, act as if you know about the client's religious world. Act as if you know because you assume their religious world is like yours. In contrast, we can earn an invitation to enter the spiritual world of the client by showing some curiosity and openness and some humility. And by conveying that, we set the stage for a partnership in learning. The critical therapeutic statements are things like, I'd like to learn more about that. Could you tell me more about a religious or spiritual experience? That opens the door for a deeper conversation. Sometimes the initial spiritual assessment doesn't prove to be informative. And that was the case with Alice, my client. She didn't indicate any religious or spiritual involvement when I asked initially. But that doesn't mean the assessment process is over. I'd like to also ask what I call psycho-spiritual questions, or questions that implicitly get at spirituality. And these are some of the questions that they're not typical psychological questions. I mean, these don't sound very clinical. Instead, they're in this gray area between psychology and spirituality. But I've often found that they lead to deeper conversation. For instance, from what sources do you draw strength and courage to go on? Tell me, where do you find peace? What sustains you in your troubles, as I asked Alice? Why is it important you're here in this world? Questions of ultimate meaning. Uh, when have you felt most deeply and fully alive? What causes you the greatest despair and suffering? Again, I found these questions help people move towards a deeper level of conversation and experience. And many people that I know, my colleagues, have said the same thing when they apply them to their own clients. Let's shift the focus then to building competency in accessing spiritual resources. As you know, our patients don't come to us empty-handed. Um, they bring with us a pool of resources that they've used to deal with the problems in their lives. But as we know, in times of stress, our clients often lose touch with the things that have worked for them, the things that have helped sustain them through thick and thin. And depression and anxiety and interpersonal conflicts, psychological problems can all result in a disorientation in which people forget about what works for them. In essence, and I like this way of thinking about it, clients lose their rhythm. And they can lose their rhythm physically, psychologically, behaviorally, and socially. One of the most important things that we can do as providers is to remind clients about their strengths and help them get back in touch with and access their resources. And it's a very hopeful perspective because it reminds our patients that they're not starting from scratch, that they already have strengths and resources they can build on. And certainly spirituality represents another type of resource for many people. And spirituality too, clients can lose touch with their spiritual resources. Part of what we can do is also help them relocate and access that resource. For example, let me go back to Alice. After her disclosure of her powerful spiritual experience, I realized that her spirituality seemed to be reserved for those times when she'd hit bottom. And I wondered, why couldn't she access her spirituality more regularly? So I asked Alice some psycho-spiritual questions. When do you feel the deepest sense of connection to your life? When do you feel most at peace, most alive? When do you feel connected to God? And she gave a couple responses, but the one that I found really helpful for her recovery was writing. Now, Alice hadn't been able to graduate high school, but she was a very bright woman, but she'd always enjoyed writing, including poetry. So I encouraged her to write, express her full range of emotions in her writings. And doing so, I think, helped her grow spiritually, but also had other benefits. And it became really important for her recovery. I worked for Alice for another couple of years, and the number of hospitalizations for Alice dramatically declined. She became much more stable. She was able to develop a part-time volunteer job with therapy dogs, helped a lot of people. So it was great to see her doing better. She still sends me her poetry, even many, many years later. And I thought I got permission from her to share one of her poems that I found really very inspirational. She writes, it's called Fireflies. She writes, remember when you were a child in the summertime at night? There were tiny little yellow lights going off and on continuously. I always thought they were flies carrying little lanterns so they could see their way in the darkness. Sometimes the fireflies blend in with the stars. Remember, when you feel in the darkness, look around. There's always a flicker of light to give you a glimmer of hope. Think back when you were a child. And remember, the fly carried his lantern. He found his way. You will too. I think you'll agree that's pretty touching and inspirational. Let me give one more clinical example of helping clients access their spiritual resources. And this involves a story of someone, I'll call him Bob. Uh, Now, I saw Bob for PTSD. He had witnessed a terrible crash on the road while helping a disabled trucker on the highway. Um, Bob had witnessed another car come along and hit the truck on the highway, and the driver was killed. I worked with him for several weeks to desensitize him to the images and help manage his emotional upset. Didn't make a lot of progress. He couldn't go back to work. He was too debilitated. So I took a step back and asked him about his life more generally and what it was like before the accident. And I brought his wife in as well as an informant on this. And it turned out that Bob had been active in his church for many years. He had been a leader, and his wife said that he said, "Boy, Bob, everybody loves him. He helps everyone." Uh, Yet no one knew of what he had been through in the church. I talked with him then about the possibility of reconnecting with the church and letting people know what he was going through. And he really was resistant to it. He felt like he didn't want to burden people with his problems. And I kind of reframed that as, Bob, this is a chance for you to give back, give them the opportunity to help you in return, and you'll be giving back to them. So I said, just try it. Just why don't you just talk to one person, your pastor, about what's happened to you? And he did. And he came in the next week and with a smile on his face, which is unusual for him. And I said, "Hey, what's going on? You look like you're doing okay." He said, "Well, I'm not sure about that. I've been love bombed." "What do you mean?" He said, "Well, the pastor, he told everybody about what I'm going through, and people have been coming by my house every day, dropping off food and sitting down and talking with me. It's like I can't get rid of him." But I could tell he really appreciated it. And it really was a turning point. And what was helpful here was just very simple, helping him access the religious support that had been available to him all along, but that had he had lost his rhythm in that sense. Spiritual resources come in a variety of shapes and sizes. They can be cognitive, such as the Nicene Creed within Christianity. They can be behavioral, such as walking a labyrinth or funeral rituals or prayer or confession. They can be experiential, designed to foster feelings of closeness and connectedness with the sacred, no matter how that's defined, such as meditation, chanting, a walk in the woods, so on. And there are relational resources, communal worship, volunteerism, counseling from clergy, and so on. And then there are motivational resources. And these are resources designed to help people find some greater ultimate meaning in life. And here I find it helpful sometimes to provide patients with inspirational readings, such as Rick Warden's Purpose-Driven Life or Viktor Frankl's Search for Meaning. I've assembled these tips over the years for integrating spiritual resources into therapy, and I hope they're helpful to you. Here's one tip. First of all, take a deep breath. If you haven't done this kind of work before, it may seem daunting, but really, this isn't rocket science. You don't need to be an expert in theology or an experienced religious practitioner to be an effective therapist. You already have the clinical skills and know-how in working with sensitive topics, and they all apply here. So you're not starting from scratch. It's important to be self-aware of your own feelings about various rituals and resources. For instance, some of you may not be comfortable with the possibility of praying with your clients. And if it's okay, then maybe to just sit with your clients as they pray. Third, be sure to give yourself permission to raise spiritual issues in therapy. Remember, surveys show that our patients and clients would like that. They'd like to be able to talk about these issues. And if not, then you can be sensitive to that as well. And remember that spirituality should be integrated into rather than set apart from therapy. For instance, as I said, in therapy, in the assessment process, we can ask about spiritual coping resources when we're talking about other secular resources and social resources. They shouldn't be disconnected. They're all part of the same biopsychosocial, spiritual being that we all are. It's important to remember that these are sacred matters, and we have to deal with them with sensitivity and care, and keep in mind that clients may not be comfortable talking about these matters of faith with you until they've until you've helped them build a sense of trust and safety in the relationship. These resources do need to be tailored to the specific needs and preferences and problems of clients. Some people, for instance, may not be comfortable doing mindfulness meditation, and they find it threatening to their own religious background and values. Remember that it takes time to reap the benefits of spiritual resources. To stay with the meditation example, clients are not likely to find a lot of benefit from meditating immediately. Most people, it develops over time. There's a reason they call these spiritual disciplines, because they take discipline to result in, I think, in changes in our lives. Be ready to address barriers to these resources. As I gave you an example of Bob, my Good Samaritan client, he didn't want to talk to other people in his church about what he'd gone through. He's afraid he would upset them. And I addressed the barrier by saying, hey, you've been helpful to them. Why don't you give them a chance to be helpful to you? It's important to work within our own boundaries. We have to remember we're not theologians, we're not pastors or experts in comparative religion. And if we start getting into those topics, then we need to kind of pull ourselves back, because this is not our expertise. Spiritual issues may go beyond our competence, and those issues should be raised with consultants or referred to other resources, such as pastors or people with more training in this area. And finally, it's important to have additional resources on hand for clients who might like to, who are interested in learning more. I understand at Silver Hill Hospital, you have a wonderful library of resources, and that's great to have those on hand. Okay, let me just take a little sip of water here. So remember, spirituality is a double-edged sword. It can be a great benefit to people, but it also can be a source of problems at times. And another competence is having some ability to appreciate and address spiritual problems in treatment. And let me give you an example of how I addressed one client and his problem, which was a spiritual struggle. I'll call him George. And I met him now many years ago. He was a 58-year-old African-American male. When I met him in my waiting room, he looked like a man who was really carrying the weight of the world on his shoulders. This picture kind of captures that. He's bent and haggard, deep-set, red-rimmed eyes that seem to stare far off into the distance without seeing anything. Before I could even take him back to my office, he said, "My brother Joe is dead." And he repeated that, and other people in the waiting room were giving him some quizzical looks. So I said to George, I said, why don't you come on back with me so we can talk about your brother? So he followed me, and he took a seat in my office and repeated My brother Joe is dead. After a while, I asked him, well, can you tell me a little bit more about your brother and what happened? So I learned that within the last 3 years, George had lost both parents from cancer and heart disease, his brother Joe to cancer, and his two sons, one to a degenerative neuromuscular disorder and the other to pancreatic cancer. To add to all that, on the way to the funeral of his brother Joe, his wife had had a stroke and been paralyzed in half her body. Um, George wasn't, um, these weren't his first challenges in life. He had also been a soldier in the Vietnam War. And he told the story of his unit, his combat unit on patrol, and they stopped to rest by near a river, and they drew straws to see who would get water for his squad. And George lost, so he had to go get the water. But when he was getting the water, his unit was mortared, and all of his fellow soldiers died. So he had had a trauma ridden life. But in spite of these trials, George had been sustained for much of his life by his faith. Um, he was a deacon of the AME Church. He took particular pride in the fact that his adult sons had never been in trouble with the law. They'd never gotten into drugs. They'd always held jobs and been responsible parents. And George had been the primary caretaker for his mother, his father, his brother, his two sons when they were dying, and he had watched them all die terrible deaths. I asked George whether he had found support through his church, um, and he told me that he had spoken to his pastor, but his pastor had said, well, surely, George, you must have stepped out of God's good graces at some point in your life. And George just shook his head with a harsh laugh, and he said, and he calls himself a man of God. I asked George of all of his experiences, what was the most painful part? And he answered with one word. He said, why? Why was God putting him through this hell? Why, he asked, had God singled him out for this misery? He saw other young men in his community, the same age as his son. They were involved in gangs, crime, drugs, and they were healthy and alive. And George said, why hadn't God taken them? His brother Joe, George said, was the best man he had ever known, a man who touched everyone he knew with God, with love. Why had God taken Joe? Then George said, who is this God? How can I ever pray to this kind of God again? If this is who God is, this isn't the God I can ever love. He said, if this is who God is, I hate him. Now, George had been traumatized in virtually every way imaginable, psychologically, socially, physically. But what I think is important here is that the greatest trauma of all for him was spiritual. He was suffering from PTSD, for sure, but the clinical diagnosis didn't really do full justice to his experience. On top of everything else, he was going through a spiritual struggle. Now, oftentimes in working with people going through trauma, we may overlook the spiritual and religious impact of their traumas, but there are times when it's the religious conflicts and tensions and questions and doubts that may be the most important issues that raised by critical life events. Again, I'll repeat that. There are times when it's the religious conflicts, tensions, questions, and doubts that may be the most important issues raised by critical life events. And I really think this was true for George. So how do we help people who may be struggling spiritually in therapy? Well, I often find it helpful to talk about the things we shouldn't do. So let me do that here. First of all, don't change the subject. Um, People often do want to talk about spiritual struggles, and these struggles can play an important part of their problems and solutions. And remember, the data I briefly showed you that spiritual struggles are associated with a variety of risk factors for serious problems, even greater mortality. They've also been shown in more recent research to interfere with progress in therapy. So all of those say, just on empirical grounds, we can't afford to change the subject or overlook them. We need to talk about them when they're part of what people bring to us. But don't assume, at least quickly, that you understand what your patient may be experiencing and talking about. As we noted earlier, there are many kinds of spiritual struggles, and they can be experienced in very different ways. So you really have to get to know the client, his struggles, her struggles, how they're affecting their lives, before we presume to understand. And don't judge. Um, Unfortunately, and there's research on this too, many people experience stigma and shame around their spiritual struggles. They can be criticized for them by family members, by clergy, by friends. And your willingness to take a non-judgmental approach to struggles of clients, I found that's often met with really a sigh of relief, and it sets the stage then for further conversation. And don't offer easy answers or bromides. It really takes time to help people with struggles. Um, we found, for instance, that um, these struggles uh, can last for a long time. George's struggles that he experienced in Vietnam, even though I saw him 10 years after Vietnam, they were still very much alive for him. Um, And we really don't have a lot of longitudinal studies on struggles, but my sense is it takes more than a few months to yield positive change and transformation. And again, don't slip into the role of theologian. Don't get into theological arguments. Don't start talking about, who God really is. I made the mistake with George at one point of bringing up the book of Job and how what he was suffering sounded a lot like what Job had gone through. And he just shrugged that off, saying, well, I don't expect God to extend my life. I don't expect God to give me a new family. I don't expect God to restore my wealth. And so I made a big mistake by trying to go down that road. Okay, so those are the things that we shouldn't do. What are the things that we should do? This is the first and I think most important part of it is just listen. Our ability to listen to people going through their pain of all kinds, not just spiritual, but that ability to listen is one of the greatest gifts that we can give them. Family and friends, it's so hard to see people that we care about in the midst of pain. And so we often, when we listen to them, we will try to maybe offer a quick problem solution or quick reassurance. And yet, again, spiritual struggles, they're not, that's not the way people are helped with them. The first thing we need to do is listen. Um, and normalized the process because we know that spiritual struggles are like all struggles in life. They're a natural part of life. We don't go through life without struggle, and they can be a source of growth if we only do the right, if we only respond to them in the right ways. Um, and my experience has been that people just respond to our listening ears with tremendous relief and gratitude. Um, when we meet their struggles with understanding and acceptance rather than any kind of judgment and rebuke. So listening and normalizing um, struggles as part of life is really reassuring. And of all the things I did with George, I think that was the most helpful thing. And I worked with him for another year And he gradually started to recover and in his life. Uh, I called him a few months after he had terminated therapy and just to see how he was doing. And he said he's doing okay. I said, well, I'm really interested, George, with how are you doing with your struggle with God? Because that had been a big part of our therapy. And he said, well, God and I have declared a truce. It's like we're in a boxing match, and he's going to his side of the ring, and I'm on my side of the ring, but we're not fighting with each other anymore. So that's where we are right now. It is interesting, though, that George had gone back to teaching Bible study at his church. So he was, I think, beginning to reconnect to uh, his faith and religious life. What else to do with struggles? Encourage acceptance rather than avoidance. Acceptance of the struggle, of any kind of struggle, is really a prerequisite to coming to terms with it. And I really, this is one of my favorite quotes by psychiatrist R.D. Laing. He said, there's a great deal of pain in life, and perhaps the only pain in life that can be avoided is the pain that comes from trying to avoid pain. I love that. Perhaps the only pain in life that can be avoided is the pain that comes from trying to avoid pain. And we've actually done some research that it shows that people who are trying to suppress their spiritual struggles, they actually exacerbate their detrimental effects. Something else to do is to foster hope and wholeness. It's important to put struggles into a normative, life-affirming context, a hopeful context. Um, and I found one resource from Japanese philosophy to be really helpful here. And and many of you may be familiar with it. It's kintsugi. Kintsugi is a Japanese art form, and it rests on the philosophy of wabi-sabi, which is about finding beauty in imperfection. Finding beauty in imperfection. So what it involves is taking a ceramic piece that's whole and smashing it. You break the ceramic piece, and then you put it back together again using gold or silver filigree, as you can see in these examples. And at least to my mind, the piece that's been um, rebuilt is a work of art. I think what's happening is that we see a new wholeness that's created out of brokenness, and the product is a work of art. Again, a new wholeness is created out of brokenness, and the product is a work of art. I've used that with a number of my clients to talk about their brokenness as an important part of life, and that they have a chance to put the pieces of their lives back together again. And the process of doing that is not unlike that of an artist creating a work of art. I found it so helpful with clients who feel broken and hopeless. And I think a number of them, that's what they take from therapy. I had one client send me a thank you letter and addressed it to Dear Kintsugi. Something else we can do is broaden and deepen spiritual resources. We foster wholeness by helping people broaden and deepen their resources generally, and that's true for spirituality too. For instance, in her work with women who had been sexually abused by men, Nicole Murray Swank found that many of these women were struggling with God, and they viewed God as a male figure. They were unable to pray to God or feel any connection with God. They were unable to access their God as a resource because that God brought to mind only the abuse. So Nicole, she created a guided imagery exercise to help them broaden and deepen their image of God beyond male attributes. So she developed this little imagery exercise in which God is presented as a waterfall. And I'll just read it to you here. She says, picture God as a waterfall within you, pouring down cool, refreshing water, the waters of love, healing, restoration throughout your body. A cool, refreshing waterfall washing down over your head, your face, your shoulders, your necks, out through your arms, down your legs, out through your toes, refreshing, bringing life, quenching thirst, renewing, refreshing, restoring. In her work with these women, she was able to achieve really significant mental health change and improvement. And the women she was working with had also been veterans of the mental health system and hadn't been successful in their treatment. So I think a part of what she did was to broaden and deepen spiritual resources for these women, so it became something now accessible to them as it hadn't been before. And finally, I want to mention that it's important here to be able to collaborate with other disciplines. Consulting with chaplains and clergy can be quite valuable. I've worked with other clergy around issues of spiritual struggle. They can deal with topics that go beyond certainly my expertise. And it's really important to have a network of connection with religious communities and religious professionals who can be used as referral sources and consultants and even collaborators with patients who are getting stuck around religious problems and issues. I should say pastors and chaplains are familiar with struggles, and listening to help and helping them resolve these issues is part of their job. I know I have my own appointment book with names of clergy resources in my community, and it's really been a valuable adjunct to treatment. So these are some of the ways that we can facilitate spiritual competencies, the competencies of spiritual assessment, helping people access spiritual resources, helping people address spiritual problems. And I hope this gives you some idea of how we can, in fact, integrate spirituality effectively into treatment in ways that are really consistent with research evidence, too. So we're left with one important question, and I'm going to conclude by talking about this question. Can we train people to become more spiritually competent? Can we really do it? Well, several of my colleagues and I took up this question, and about 10 years ago, we designed what we called the Spiritual Competency Training Program in Mental Health. The acronym was SCTMH. We spent a lot of time trying to come up with a easier acronym than that, and we couldn't do it. So it doesn't really roll off the tongue, SCTMH. But that's the program that we developed to train providers across diverse mental health professions to meet these basic spiritual competencies. We used adult learning instructional methods. We created an online training program made up of 8 modules on 8 hours of multimedia content that dealt with the different competencies, including the 3 that I reviewed with you. We then evaluated changes in attitudes, knowledge, and skills. We had mental health providers from all over the United States take this program online. And then we evaluated changes in attitudes, knowledge, and skills. And the results were really encouraging. As a result of the program, the providers significantly increased their spiritual competencies and measures of attitude, knowledge, and skills from pre to post training. Here's an example of one qualitative comment. This was very informative. It helped me see that spirituality and religion could be integrated without it being seen as conversion, or trying to put your viewpoints on others, but rather using where they're already coming from as a source of healing and understanding. We've now replicated this program 3 times, including a program in which spiritual competency training is integrated into graduate programs in mental health with, again, similar results. We've been able to improve knowledge, attitude, and skills. And currently, we're thinking globally. We're now planning for a global initiative to foster spiritual competency training. We're right now interviewing mental health leaders in the area of religion, spirituality, and mental health from countries all over the world, South Korea, Argentina, Greece, and Spain, all over the world. It's been very informative, and we're hopeful that our program can be adapted to these cultural contexts and made meaningful to providers and patients across the world. So this really is an exciting time to as we move to a more integrated approach to mental health care and training, an approach that really acknowledges that we're spiritual as well as psychological, social, and physical beings. Um, I know this has been somewhat of a whirlwind tour. I've covered a lot of ground, and believe me, there's a lot more out there. If you're interested in taking a deeper look at this, here's my only plug today. You might take a look at my books on this topic, on these topics, and uh, they all have lots of clinical examples and empirical studies and guidance, I think, to help us in our efforts to bring spirituality more fully into the ways we try to help people. Um, so I think I'll stop here and we can open it up maybe for a Q&A.
Fantastic. What a whirlwind, Dr. Fargman. It's so helpful to have you really leading us on thinking about this integration and what is our role and what are our boundaries in working on this? How are we supportive and not harmful? Really just beautiful questions. Everybody, go ahead and put your questions or ideas in the chat. We have about 20 minutes, and I'll go ahead um, and get started. Are you ready?
I am.
All right. So we have a question here. The work you are doing is so important. Have you worked with clients who've been in cults? This is a huge issue with them. Sometimes religion was used to harm them, so avoiding the conversation would be detrimental. Helping them define their own way to spirituality is part of the healing process. Also, individuals with addiction disorders can find great help for their recovery in their spiritual connection. That's about the really important ideas.
Yeah, the second part, I think the evidence is pretty clear that spirituality is a really important resource for people with addiction disorders. 12-step programs, I think, are, at least I conceptualize them as fundamentally spiritual in character by offering people an alternative to the kind of worship of drugs or alcohol or whatever the addictive object may be. And so helping people make that transformation from drug and alcohol worship to finding more sources of ultimate meaning that have staying power, I think is an important part of the treatment program in dealing with alcoholism or drug addiction. Uh, the issue with cults, I think, first of all, I think it's important to say from the outset that most people who are involved in cults uh, are involved only for a brief period of time. Most, for instance, adolescents or early adults who try out a cult are experimenting. They're at this kind of time of life of looking for answers and solutions. So they look for a variety of they look for these answers in a variety of places, including religious cults. And the research shows that a number of people who get involved in cults only stay for a relatively short period of time and then move on. So, we have to be careful about not sensationalizing cults and the dangers that they may have. But it is true that there are some cults that do trap people, that do tremendous damage. And it's just more generally, it's true that people can develop incredible dependence and passivity to religious leaders and religious communities and give up any agency they may have in their lives. And that's a terrible challenge for us. And just more generally, how do you work with people who are so dependent that they just have um, Eric Fromm talked about it as the escape from freedom. That we're so yearning for some answers and some definition and some safety and stability that we give up our own initiative and autonomy. And I can give some examples of how I've done with some of that over the years, but those are just some general reactions to questions about cult involvement.
I guess I want to hear those those examples, but there's 18 other questions here, so probably should yeah should move on. Thank you for that so much. Here's a question. I came across a psychosynthesis master's program in the UK, which marries spirituality and psychology. How does this compare to or differ from what you've described today, and why is psychosynthesis not as prevalent in the US? And I guess I would just add on to that question, Dr. Parkman. What about programs that integrate kind of teaching around spirituality and around the boundaries of what we as mental health providers do, and how much training helps somebody to move into new roles?
Yeah. Well, there are a variety of programs that are kind of dealing with different facets of integration. And some of these programs are coming out of a particular religious or spiritual tradition. And so the integration is within a particular spiritual or religious frame of reference. Some of these programs are also coming out of a particular psychological perspective or tradition. So there are programs that integrate religion and spirituality that are more CBT oriented, some that are focused on Eastern practices and traditions. So there's a lot of going on. I mean, the field is really in ferment, and it's difficult. I used to be able to keep up with this literature by going to the library once a semester and reading everything that I could, and still having some time at the end of the day to take a nice walk around the campus. That's not possible anymore. There's so many programs developing that have been developed and out there. I don't know about this psychosynthesis institute or program in England, so I really can't answer that. But I know there are lots of programs all over the world now that are developing and have been established.
Great. So, question here, just as there are psychological assessment tools, might spiritually integrated psychotherapy, SIP, utilize spiritual assessment tools such as SCAI framework, Facet-SP, 7 by 7, Spirit, Hope? Many of these tools are utilized and developed by hospital chaplains. Might psychologists borrow from the work of chaplains?
Yeah. Well, yes, I think these methods have been established and validated, and yeah, a lot of the work has been done in medical contexts, which is great. The issue is in psychotherapy is that um, I don't think that there are, even though I've developed some of these tools myself, but I don't use them very often, I have to say, because I think that we learn about someone's and can assess someone's religion, spirituality. It has to be a process. The initial assessment through psychometric methods can be useful as a part of that process. But again, people may not respond uh, fully in the beginning because they haven't established trust. So they're not going to respond with something about intimate matters like spirituality. And some of the attitudes and feelings they have about religion and spirituality may not even be conscious. They may not have been able to, they may not have articulated them to themselves yet. So the assessment process actually becomes one that continues throughout therapy. We continue to develop our understanding of the patient and the role that spirituality, as well as many other factors, plays in their lives, and that evolves as the treatment evolves. So, yeah, I think it's important to have psychometric tools that can be really used, especially in the beginning of therapy. But I would hesitate to rely fully on them because of the limitations I've just mentioned.
Great. Another comment here. Thank you for including Swank's work. Part of being open is understanding the influence of the patriarchy on of some religions, and that others believe in source energy, energy of the universe, or creators that are not male gendered or monotheistic. So I think kind of agreeing with kind of what you were saying or building on that.
Yeah, I didn't say much about it, but my own definition of spirituality is I see it as a search for the sacred. It's what people do to discover, hold on to, and at times transform what they hold as sacred in their lives. And I really like the term sacred because it's inclusive. It includes traditional understandings of divinity, God, Buddha, Jesus, Muhammad, but it also includes other aspects of life that we endow or imbue with higher qualities, transcendental qualities. And in that sense, nature can be sacred. Um, Loving relationships can be sacred. Wanting to make the world a better place can become a sacred pursuit. Work can be sacred. I know for many of you out there, what you do is not a job, it's a vocation. It's a source of ultimate meaning in life. And so it's really important in working around religion and spirituality, to ask questions not only about how people may see God, but also, well, tell me, what do you hold sacred? Where do you find sacredness in your life? What do you do to kind of cultivate that connection with whatever you may hold sacred? And if people think sacred is a little bit too woo-woo, religiously religious, well, you could talk about, well, tell me, what do you hold most precious? What's the deepest and most deepest ultimate value to you? We're talking about the same kinds of things, even if we're not using explicit sacred language. So, yeah, and the example from Nicole Swank is, I think, a really potent example of how we can approach spirituality in ways that are non-traditional and extend the usual ways we think about religious life.
Beautiful. Thank you. Um, Here's a couple questions. In my practice, I have several patients who struggle with their religious beliefs and dictums, whether sexual orientation or premarital sex or infidelities. These people truly struggle with maintaining their religious attachments and the spiritual connections they felt in the past, and now feel they no longer belong, or they question what they have believed their whole lives. How do you suggest addressing this? Beautiful question.
Yeah, it's a really important question, and we do find in the research that we've done that people in LGBTQ communities, they are among the highest of spiritual strugglers, um, struggling with questions about God, with the dogma of their religious tradition. Interpersonal struggles are really common, where they're struggling with family, friends, clergy, about sacred spiritual matters. And these are very potent. They're very predictive of troubles for people when they're not addressed and resolved. So, first of all, your willingness to listen, as you would any other sensitive topic, to listen and normalize those struggles, because they are really, I think, quite normative, especially within LGBTQ communities. And then to help people talk about the kinds of options they may have for finding a place which welcomes who they are as human beings, including their sexual orientations and preferences. And there are some niche communities out there that do spiritual communities that are quite friendly to LGBTQ uh, individuals. But the questions about how could God allow this for me, or how could God have created someone who God is telling me that I'm sinful? Those are really powerful questions that deserve a lot of therapeutic attention, and helping clients sort out their feelings for themselves around it. It's another example where having a clergy person who would be LGBTQ friendly as a consultant or even collaborator can be really helpful.
Yeah. Some beautiful things here in the chat about loving Alice's poem, about somebody nodding their head with everything you were saying in agreement, and many thanks. I don't want to um, forget to say those. And there's one longer longer writing here, and I'll take the second part of it. It says, I had a client who was damaged psychologically because of her caregivers were Jehovah Witness, and she was not able to engage in activities with other children because of the religion. She ended up hating God, and it took her years to distinguish God from the religion and be able to come to her own sense of spirituality, to come to peace with God through a connection with a different church and pastoral counseling. So, yeah, any ideas about how to work with people who've been we've talked about this a bit, hurt or harmed, and how to help them find what is sacred.
Yeah, well, beautiful example and powerful story that this person shared. Yeah, I too have worked with people from different, very conservative religious groups who've been terribly wounded by the religious community, clergy who've been involved in sexual abuse, who've used their church as a place for them to lure victims. And it's I use the phrase shaken to the core. These are some of the most uh, deepest traumas we can experience because they shake us to our core, our basic assumptions uh, about trust in the world, about people who we believe would be represent the secure base for us, the nest that we can go to in times of stress, people who we feel may be most uh, representative of the highest qualities we can have, most connected to God or some divinity, and then to have those figures um, really violate us, betray us. It's a shattering experience. Talking about kintsugi art, where you are shattered by that process, and it does take tremendous time to begin to reestablish a sense of trust in others because the trust has been violated at such a deep level. We know, for instance, that of all types of sexual abuse, clergy sexual abuse may produce the longest lasting and deepest impact because it is a violation, not only psychologically, socially, and physically, it's a spiritual violation. And it takes a long time to recover, and finding safe people and patient people who are willing to listen and walk with the survivors of these experiences through their recovery path. I wish I had some easy, these are the five things you need to do, but no, this is where being a human being with another human being who is suffering, that's first and foremost the key.
Great. Is there a different way you'd recommend integrating spirituality and work with children and teens?
I've talked to some people, some child psychiatrists and psychologists about it, and that area is so undeveloped. Even theories of spiritual development are just really poorly developed. We know enough to know that children from the outset, I think, are spiritual beings. They ask powerful spiritual questions. They address spiritual conflicts and dilemmas from a very early age. But how do we help them access their spirituality in ways that are going to be meaningful to them and help them through their trials? It's a question beyond my boundaries right now. So, but there are some people who are doing some work in the area.
Great. There are so many questions that are coming in here. Is there research on using psychedelics like ayahuasca, LSD, psilocybin to promote spiritual or religious growth? Are these experiences considered the same as traditional religious or spiritual experiences?
Um, there's been And you may be familiar with it. A lot of research in recent years, triggered by or headed by Roland Griffith, who passed away recently from Johns Hopkins, on the impact of psilocybin on personal transformation. And the experience, the research, at least as I've read it, and I reviewed a couple of the papers, I think is very uh, provocative and powerful. That relatively brief exposures to psilocybin seem to be showing dramatic effects that aren't just short term but long term. Dramatic effects in your goals in life, your sense of connectedness to the world, your positivity about life, and your spirituality. And as a matter of fact, there are some who believe that the psilocybin effect is really it works through spiritual experience, that psilocybin creates mystical like spiritual like experiences, and that's really the kind of key ingredient to transformations that can take place. It's been, as we were talking about, Dr. Katzman, your interest in it and around PTSD. It's being now tried with people with a variety of problems, PTSD, alcoholism, depression, and so far I find it really encouraging. I do wonder whether it's possible to create the same effects as psilocybin through non-pharmacological means. For instance, we've been doing research on what we call sacred moments, and these are moments that are transformational moments in life where we really feel a sense of connectedness, deep connectedness to another person. We feel that we've reached some kind of epiphany or understanding of basic truths, uh, where we experience these sense of awe and uplift. And these experiences are not uncommon. And they are also transformational experiences. So I wondered whether or not we tried to pit sacred moments against psilocybin to see, whether we can uh, trigger these powerful experiences through non-pharmacological methods. But that's for down the road.
Right. Yeah, I know if I'm remembering correctly, the work of we were talking about Michael Bogenschutz, who's going to be doing a study with us at Silver Hill on psilocybin. His original work at University of New Mexico involved working with patients with substance use, and it was if they characterized having had a spiritual experience, however they categorized it, that was actually very, very aligned with recovery and decrease in cravings is my memory of
Yeah,
that
yeah.
study that's now very
Oh,
famous.
that's neat that you're going to be doing that there at Silver Hill.
Yes, exactly. Is that's there are so many questions here and so little time. Um, so I'm gonna end with this question. What kind of training or resources are there in helping us all learn about self-awareness, transference, and countertransferences in the world of religion and spirituality?
Well, if you're interested, I can get you the SCTMH website that it's a nominal cost to take the program, but I think the program has lots of good resources and suggestions. We have videos and addresses a lot of those kinds of issues and the general competencies in the area, at least to develop basic spiritual competency across the board. So I don't have the website right in front of me, but I can share it with you maybe through the Silver Hill.
Fantastic. That would be fantastic. And I also want to let people know that these slides and this video will be available in the next day or two on our website at silverhillhospital.org /videos, and maybe we can find a way to include that, Dr. Bargman, in with that. So with that, thank you so very much. We are at the hour, and there are 15 more questions. I'm sorry, everybody out there, if I didn't get to your question, and I think we could have a whole conference about this and maybe invite you out to Silver Hill and a couple other people. Maybe we can have a panel discussion about really some deep, important questions. And I mean, what deeper question do we have about what do you consider sacred? And thank you for guiding us all in that direction. I will be thinking about the broken bowls And was it Katsugi? Is that the name of it?
Kintsugi, Kintsugi, Kintsugi.
Kintsugi method. Yeah. I think for the rest of the day. And
Yeah, you
thank
can
you
go
again.
online under Kintsugi and see some beautiful artwork.
Oh, fantastic, fantastic. Wabi-sabi, yes.
Yes.
So thank you everybody for being here today. It's our last grand rounds of the year, and we will see you again in September when we resume again with Dr. Swift, as I said. And Dr. Parkman, there are lots and lots of thank yous here for you, including a please do a conference on spirituality, I think, for me. So maybe we'll talk about that. Thank you. And thank you for that endorsement. All right. Thanks, everybody.